it's best to today to answer those questions. So please welcome the rest of the medical team, Dr. Nifade, Dr. Rita, and MI.
Thank you, Ma.
Yeah, so we go from here. So I'm going to ask the first question we have today, and any of us can, decide to answer those questions. So the first question we have today is, which solution pack is suitable for somebody with heart-related issue? Which solution pack is suitable for someone with a heart-related issue? So anyone can go first.
Hello.
I like this your look, Dr. Nifade.
Thank you, MI. Thank you.
You're welcome.
Yeah. Good evening, everyone.
Good evening.
Good evening.
Seems the network is it's not doing justice here. Okay, so I think while we wait for Dr. Nifade to come back, I would like to do a bit of an intro in answering that question, right? I mean, since the solution packs came on board, I mean, it's just solution packs. I mean, the name is just on point, right? And it gives you an opportunity to be able to recommend based on different health conditions that people have. Okay, so, and I like the way the question goes to say which solution pack. And I look forward to a time when our questions will begin to go more in the direction of solution packs, because they cover a longer period of time and you can really truly measure the effects of what is being used over a period of time. Because what happens most times is, for example, somebody is battling a health condition that requires management, okay, and doesn't particularly have a cure. And the person gets a bottle of RIDA bitters and says, after using the bottle of RIDA bitters, I'm not really feeling like, I feel a bit better, but I feel like, so I'm wondering, okay, what do you expect a bottle to do in the, in the whole context of what you have to manage, as it were. So, but the solution packs give you an opportunity to, over a period of time, manage specific health issues and, be able to have measurable results, something you can really measure and truly say, okay, within this period of time, I can measure, what the pack, is addressing. So that's really something I wanted to just add there. Okay. So for the person managing a heart condition, I would say that the hypertension lifestyle pack can be recommended for that person. Okay, so that's the answer I would give. I don't know whether anybody has any other thing in addition to that. I just wanted to give an introduction to the solution pack. I don't know whether at this point, Ma, you would want to just kick in about the dosage and all. I'll show the slide. So we can do that once or twice in the course.
Okay. Thank you, Emma. Yes, I believe that the hypertension, especially if the person also has hypertension, I guess my response also would be, it will be important to know what exactly is the heart-related issue. So that means that the individual would have seen the doctor, they would have had they would have been examined, they would have been investigated, fully assessed, and then a diagnosis would have been made. But definitely the hypertension lifestyle pack would be a solution pack that can support whatever management, the individual has been placed on.
Okay.
So yes.
Okay.
So did you want to show the
Yeah, okay, I can do that. Okay,
Okay.
and yes, we have good news in the house. Okay, we actually have fantastic news, and this news, has taken us a couple of, say weeks, to put together, and we have documents that that give the appropriate dosages for all the available solution packs. So now for every solution pack, there's a dosage document that comes with it. Okay, and I think that is fantastic news. Okay, and we're going to be able to access that anytime from tomorrow. I just wanted to show us, just show us what it looks like so that we can appreciate the work that has gone down. And, we have amazing people in the medical team who give their time and all of that to ensure that this was made available. I don't know whether we can see it.
Yeah.
Yeah. So, yeah, you can see the female scene. I like the sassy senior citizen, like a senior citizen that is not just green, like Dr. Fumia, Oh my God. So you can see, you can see this is a dosage regimen, right, for the female senior citizens pack. And you can see it has an introduction, says that people from age 65 and above, are the ones usually referred to as senior citizens. It just gives you an introduction. It gives you what the pack contains. You can see it here. Then you can see the very colorful table in the middle there, gives you what the dosages for the different products will be. So you have one from day 1 to 90, day 1 to 30, day 30 to 90, the products to be taken, and then what you take in the morning and what you should take at night. And then it gives you the other products that come with it and the value that they have to offer, and some extra notes at the base. So this is an idea of what is available for each and every one of the solution packs. If you are excited about this, I want you to show some excitement in the comment section. And we know that some people are going to join us later, like in the course of this meeting. So we're going to show this again, like once, at least before the end of today, so that we can become aware and look out for it. So we have this available for all the different solution packs. So that's it. Over to you, ma'am.
Okay, thank you very much. I think Dr. Diron is back in the house. The second question here is, what is the dosage and usage for fat burner? What is the dosage and usage for fat burner? So I don't know anyone can go for this. Yeah, many people are excited about the dosage guides.
Is Dr. Diron back?
Yes, he's back.
Okay, good evening, everyone.
Good evening.
Just go ahead.
You can go ahead.
Okay, should I go ahead?
Yes, please.
All right. All right, the dosage for the fat burner, if we are making use of the solution pack, which is the weight management pack, we'll be looking at using it in combination with RIDA herbal bitters or capsule. And it's preferable to take it at night. That's the fat burner, because you have high cholesterol.
Wow. Internet is showing people today. What's happening?
Okay. It seems we've lost Rita for now. While we wait for her to come back, maybe I might step in there. The fat burner, on the packet, the dosage says 2 capsules daily. However, if an individual is trying to manage their weight. Okay, you're back. Would you like to go on? Hello, you need to unmute, Rita.
Okay, can you hear me now?
Yes.
Yes.
Okay, awesome. Okay, so I was talking about taking RIDA fat burner in combination with the herbal bitters, and the fat burner should be taken at night, preferably 2 capsules at night, because that is the time where you have the high cholesterol, where it's majorly released. So it's preferable to take that at night. Then you take your RIDA bitters in the morning before food. Now, if you are working on your weight, you also need to make some lifestyle changes. You don't just take the supplements without making the necessary changes, because once you stop the supplements, whatever baggage you have accumulated will come back to you. So you need to exercise, you need to watch your diet, eat balanced meals. You can't be telling me that you want to lose weight and you are maybe taking a bowl, a very big bowl of eba or swallow in the night. So you need to take necessary steps. Okay, so I think I've answered the question on the dosage. For the herbal bitters, you either take 10 mils or 20 mils in the morning, while fat burner, you take 2 capsules at night. Thank you.
Thank you very much, Dr. Rita. If I may just add the fact that with the solution pack guide, we have found that cleanser actually potentiates the action of the bitters. So in the weight management pack, the cleanser is added to the morning dose of the bitters. But I mean, we might not necessarily need to go into every single dose here, because by tomorrow we're going to all have those documents for each solution pack available. And I just want to say that in addition to increasing the one's metabolic rate, the fat burner actually suppresses the appetite as well. So it helps, and like Rita said, you need to make lifestyle changes as well. Thank you very much. Now the next question, just a minute. The next question, it says, which of the solution packs can be recommended for a cerebral palsy patient? I guess maybe Dr. Onifade would like to go for that. You're back in the house.
Okay, yes. Can you hear me?
Yes, we can hear you.
Okay. The next so funny. So that's why I need to off my video.
Okay, that's
okay.
Fine.
So in answering that question, we always like to start things from first principle.
Yeah.
So cerebral palsy. Yes. So we look at what causes cerebral palsy. Most times, cerebral palsy is as a result of when during the delivery period, maybe the child did not cry on time, and what we use in medicine to score how active or other things that we look at in the ABGA score. So most time when it is very poor, the child will not cry properly, and it decreases the amount of oxygen that gets to the brain from the lung. Because people wonder that why do child cry at birth? Why do you always want a child to cry? Because when they cry, the lung is expanded, oxygen gets in, that oxygen at the same time gets to the brain and make the child active and all that. Oxidative stress is not enough to do what it's supposed to do to get to the brain. So it's a form of oxidative stress. So the child develops cerebral palsy because of that oxidative stress. And we look at it that most people that have this thing are always young people. Probably they now seek help and all that. So from what we have always talked about with our products, that's what antioxidant and oxidative stress and all that. So it is quite simple that which of these products is really, really, really
Internet.
The network is really bad.
I think it's out. I hope it's back. And it's still speaking.
We can't hear you, doctor.
And it's
important when it comes to oxidative stress. And we all know it is the bitters. Okay. So when it comes is our bitters, and because these people are normally young or very, very young. Can you hear me?
Yeah, I can hear you now.
Wow.
You can hear you now.
Can you hear me?
Yes,
This
now.
is so bad. Can you hear me? Network is bad.
We can hear
Can you hear me?
Okay, where did I stop? Where did I stop? Okay, I was talking about the cause of the
young people.
oxidative stress that is as the result of. Can you hear me?
It's going in and out.
We can hear you.
Go on.
Okay, I said I explained the oxygen and the lungs, how the oxygen gets to the.
Yeah,
we had that.
All of that. Okay. So if you look at our products, which of these products is really very, very good for oxidative stress? Of course, it is the bitters. And because these are young people, we are going to start with the bitters. And normally, we always advise that we start slow with a very low dose, which depending on what we are getting, we can increase this. So I say 2.5 mils, which we can increase to 5 mils. So you can say 2.5 mils morning and night. Then depending on the age of the child, you can graduate it to 5 mils morning and night. Can we hear me still?
Yes, we can.
Yes.
Okay. So what you use is the bitters. The bitters for cerebral palsy to balance the oxidative stress, oxygen delivery to the brain, which has been faulty from it. We think this might help. The child is going to need physiotherapy, sort of things. So the fact that it's on the bitters alone doesn't stop there. You still have to scale it up to physiotherapy and a little bit of rehabilitation. So that is the answer for that. Thank you.
Thank you very much, Dr. Nifade. So we have the next question. What is the combination for female conception after several miscarriages? Who would like to go for that?
Okay, let me try and say something. I know that Dr. Nifade wants to speak, but let me just jump into that. Unlike what many people think, there are several causes, or there's more than one cause for miscarriages. Some you just don't know. Sometimes it's just the body's way of just voiding a baby that is not properly formed. Sometimes it could be fibroid. Sometimes it could be, it could be a number of factors, right? That could be responsible for miscarriages. And it's important in this kind of case to do a thorough investigation of what is responsible. I don't know what specific word to use, do a thorough analysis, go hormonal, go do all the scans, and ensure that physiologically, in terms of checking the hormonal profile and all those things need to be checked to know. Sometimes, the environment within the uterus is hostile because there's imbalance. There are a number of things. So it's important to have a report to work with and to have a report that is as current as possible. Sometimes people come with this and they've not really done an investigation for a while. It's not a good thing to have a situation where something that is not good becomes the norm for you. It's possible to feel tired and feel like, why is this happening to me again and again? But it's important to still check and have a position, right? And when you have a position, I believe, you would see your doctor. I mean, if this is happening consistently, it's good to have medical advice to know what one should do. And in addition to that, which is why I like the RIDA range of products, what they will do, what the products will do is that they will give you an opportunity to support what you are being given by your doctor. So in this case, I would say that I believe that the female wellness pack will be a safe one to go with. But of course, that's also subject to having a thorough investigation and interpretation, by a medical person, to know exactly what it is. So somewhere between the female wellness or the fertility pack would work. But of course, you want to ensure that first the body is okay before you take in again. The trauma of having to have miscarriage over and over again is not healthy. So I mean, if anybody asks me, the first thing I would say, apart from all what I've said about seeing your doctor and all of that, is the female wellness pack to get the body back, before you say, I mean, I want to take in again, to avoid all of the trauma that may be attached to it. So that's just my own simple thoughts.
Thank you very much, Emma. I may just also chip in a bit. When a woman has a miscarriage or miscarriages, even without doing investigations, before doing investigations, one can sort of have an idea where the challenge is, depending on at what part of the pregnancy is the miscarriage happening. If it's early, very early, maybe in the first 8 to 10 weeks, like Emma said, it could be genetic issues, it could be something that the body, some intense congenital abnormalities that are not compatible with life. But if it's in the second mid-trimester, that is after 12 weeks, it could be due to a condition called cervical incompetence. All these would be revealed during investigations. And what I'd like to say is that if the woman has had several miscarriages, then probably conceiving is not really her challenge. She's not really having a challenge conceiving for her to have had several miscarriages. Several miscarriages means that she got pregnant several times. But, just like Emma said, our products, I know that the wellness pack and the fertility pack, they contain Restore. And one of the properties of Restore is to strengthen the uterus. So one of those packs, I'm just corroborating what Emma said, one of those packs, no matter what the cost is, would support the management. So we would say the female wellness or the fertility pack. Okay. Now, the next one is also in the gynecological area. It says, which of the RIDA range products? Okay, Dr. Onifade wants to say something. Please go ahead. Hello? Is somebody trying to say something?
Dr. Onifade is trying to
Okay. Dr. Onifade, or do you want to type it? Because we can't hear you. There are actually a lot of questions in the chat box. I don't know whether we should take some of those.
Doctor, I know.
Yeah, go ahead.
Can you hear me?
Yeah, we can hear you. We can hear you.
I don't know if you can hear me.
We can hear you now.
Yes, I will type it. Okay, I want to add something to.
Please go ahead.
I want to add something. Okay.
Go ahead, we can hear you. Hello?
Maybe he's typing.
Oh, okay, maybe he's typing. Okay.
Maybe.
Today's network is really... can't hear at all.
Dr. General, just type. Just type.
Just type. What I think I'm going to do now is I might pick some of the questions in the chat box. I see somebody asked, how do we combine the RIDA Restore Cleanser and bitters for infertility?
Document is ready.
The document, the answer to that is you will see it in the document shortly in the next 12 to 24, less than 24 hours. It will all be revealed. The next question here is, just a minute. How can one recommend the combination of RIDA Fire and RIDA Cleanser? Again, there are a number of solution packs that include RIDA Fire, Cleanser, and bitters, and those are the things that were addressed in the dosage guides, which you're going to get in the next few hours. I don't know, maybe do we want to show one of them at this point, another of them, maybe one of the male?
Okay. Okay, I think we can continue.
Okay.
Okay. Don't wait too much time.
Okay, so can a lady on family planning for birth control take Restore? Who would like to answer that?
On birth control. Okay. I think I would like to make a comment on that.
Okay.
Yeah, so if I'm not losing something. Yeah. So yes, someone on birth control taking Restore. The answer is yes. I believe the person taking birth control is off, is no longer breastfeeding, and the only reason is because she doesn't want to take in again. Okay, birth controls come with their own fair share of side effects. Okay, and I remember a time I went to see my doctor, and then I told him I was on implants, and he screamed and said I should, I'm using it for a prolonged period of time, blah blah blah, and I should give myself some space. I know that birth control over a period of time can come with its own fair share of side effects. So what best to use than something that supplements what may be what may be under, I don't want to call it under threat, because you're trying to suppress something. There are some things that could suffer for it in the body. So Restore is very good for someone who is on birth control. It does help to balance, because what birth control medications or whatever, what they actually do is they alter the way the body should function normally. They do alter it. Okay, and if something alters something, as much as possible, if you have something that is at home with the body and helps you balance it out, I think you really should just go for it. Everyone that is using birth control, Restore is safe to use, and it really does help to manage the possible side effects and to balance the hormonal profile of the body. So I would say yes.
Thank you. Does anybody else have any comments? Dr. Diron, are you back in the house?
Okay, he has typed.
Oh, okay. Let me read what he typed. Okay. Concerning frequent abortions, cervical incompetence is a major factor in this. Don't forget that in cervical incompetence, the cervix is weak and dilated during pregnancy, giving room for the pregnancy to abort in early pregnancy. So apart from the female wellness or fertility pack, the woman should do a cervical ultrasound to measure the length of the cervix, and if it's dilated, it may require to be tied during pregnancy. Prior to pregnancy, a woman with such a history should be on the female wellness pack. Yes, a woman on family planning should be on Restore. Thank you very much, Dr. Onifade. Yes, the tying of the cervix, it's an operation done, it's a minor one, but it's done at a certain time during the pregnancy before the period where the miscarriages occur, called a Shirodka. Now, the next question, let me try and pick some of the ones here. Somebody asked here, will any of the products help a woman who complained of low libido? If so, how does it work? And the second question by the same person is, can an autistic child benefit from any of the products? So who would like to go for it? Does anyone want to go for it? Okay, will any of the products help a woman who complained of low libido? If so, how does it work? Again, we have the female wellness pack. The bitters, even the bitters would help with low libido, but Restore, again, Restore restores, and balances the hormones such that the woman's libido would return. I believe we've had a number of testimonials from people who have used the female wellness pack and it has improved their libido. I don't know if any other person wants to comment on that, but before you do, let me just answer the second question. Can an autistic child benefit from any of the products? The answer is yes, because the autistic spectrum disorder, which is, autism is a whole spectrum from, minor to major, and oxidative stress is one of the factors that has been postulated in autism. And so I believe that the bitters, because it's a child, children are not, we don't recommend the variants for children. And so such a child would, I believe, would benefit from bitters, along with any other measures the doctor, health provider has recommended. But I don't know whether any other person wants to add a comment about the libido. Okay. Okay.
If you can hear me, I've typed something in the chat.
Oh, okay. Let me see. Yes. Recommend the female wellness pack for such a person. It is a wellness problem. Yeah. Okay, the next question. I'll take. Okay. What advice do we give patients taking orthodox drugs and want to take the RIDA product? From my interaction with a few, a lot of them don't want to stop the other drugs. So anyone can go for that, please.
Can we hear me?
Yes.
Yeah.
Okay.
Dr. Onifade, we're hearing you in and
going?
out. Okay, does Rita want to go for it?
if he's there already. Right? We've lost him. Okay, if you happen to be on orthodox medication,
Should I go on?
okay, please do.
Go on.
Okay,
Don't worry, go on.
Go on, Dr. Onifade.
so can you hear me?
Yes.
Yes, we can.
Okay, so orthodox medicine and our products that can they use together, most people want to continue. Yes, we've always advocate that you don't need to completely stop all these products, all these your orthodox medicine because you are using our product, because there's something we explain about potentiating the effects of those drugs. For example, someone that has hypertension, a BP that is very, very high, we will not say, okay, maybe you're on amlodipine or lisinopril, or because you have started the beta, you stop it immediately. At times, some of these drugs might not work effectively for you because of the oxidative problem and the way your cells are reacting to these drugs. So if you take the RIDA products, it clears all those negative things that might make your drugs to be active. So, but we always advise that you space it for like 2 hours. You don't need to actually stop it. You space it for like 2 hours. Then by the time some of those things are resolving and your immunity and your oxidative thing have been corrected very well, you might gradually now scale down these other drugs that you are using. But once you first start, you don't need to stop. Just time it, maybe like 2 hours, because of the metabolism and pharmacodynamics of these drugs. Okay, so just space it for like 2 hours before you use your orthodox, but we don't say stop it completely. So that's what I have to say about that. The pharmacies
We've lost you.
Wow. Okay.
Okay, Dr. Rita.
All right. So just to add to what Dr. I know,
and
sorry,
have
Dr.
a lot to say
Jero
about
has said.
pharmacodynamics and all.
Yeah.
Wow. Okay. Just to add a little to what Dr. Jero said. So while you are taking your orthodox medication, you are using RIDA as a supplement, which is properly spaced. You know you still need to visit your physician, visit the hospital for checkups, and as that is going on, your orthodox medication is reviewed. And over time, you see that you are weighing off the number of drugs, like the example you gave of hypertensive patients. So we have several patients or several people like that who are hypertensive who take so many medications, as much as 6 medications. But from experience and what we've seen with the use of RIDA, over time, we've had testimonies of people being weighing off those medications, and medications are reduced from 6 to 4 to 1. And we've actually had someone who has totally stopped and just stays on the supplement for now. So basically, make sure you visit your physician and do your checkups. Don't just stop abruptly like that, because we have a lot of people who do that in our midst. So that's just caution. Thank you.
Thank you. Emma, would you like to?
I'd like to add something. I mean, this is a bit
Yes.
fresh. Yeah, this is a bit fresh, and this is someone I've known from school, right? She's based in the UK. She heard about RIDA, you know, and she heard about it at the time when she went to see her doctor, and even the doctor was really bothered, like, your blood sugar is like up the roof, you know, what is happening, blah, blah, blah. So she was agitated, she was worried and all. So, and she had been hearing about RIDA, blah, blah. So she started and stopped. You know, when you're not sure, started, stopped and all. I think earlier in the year, she started using it. She told me, I want to take this thing seriously, because I mean, it's like up the roof now. So she started taking it very seriously. And, you know, she called me last week, and that day it was a very hectic day for me. I mean, I was tired. She called me around like 5:30 after a really long day. I was still at work, but, you know, when I saw her, I was like, oh God, you know, because she was always calling me for one thing or the other, you know, this information. So I was trying to gather my energy, like, what does she want to ask me today? And then she gives me like the news that just made my day, you know. She just got off with her doctor and she gave me data about her blood sugar. And her doctor told her, whatever you're doing, I know you're doing something, you're eating something. And she gave me the numbers, like her HB1C was 67. Yeah. And as at that time, she said it was 46 after she had used RIDA for a while. She was just excited. Yeah. Her HB1C was 67 actually. So she was
Not 6.7, 67.
67.
Wow.
So, I mean, so she was just like excited. And I had to tell her that you really made my day, blah, blah, blah. So, I mean, what I'm trying to say is this. She didn't stop seeing her doctor, you know. Sometimes you need your doctor to make you feel like what you're doing is working. So don't throw your doctor away because you are using that range of products. You need somebody to like affirm, someone to give you, you know, the confidence, like, yeah, what you're doing is working. And she got that and it gave her a lot more confidence. And then she went on to talk about her friend who had hormonal issues, very bad hormonal issues. And, you know, I think about 2 weeks before she got her own good news, she called her also with good news and all of that. You know, if they're not seeing their doctors, if they are not following up, they won't be able to measure, you know, what is different they've been using and how, you know, what difference is making to them. So I was just corroborating this to say, see your doctor, use your meds. Your doctor may now be the one who would say, okay, let's adjust your dosage a little bit. That feels better. That sounds like, you know, so
making progress.
Yeah, you can measure the progress. Your doctor, you know, is making you feel like, yeah. So I just wanted to add that.
Okay, thank you very much. Now, I think we'll take one more question from here. And this, actually, there are two, but this one, it says, a man that commences fire and bitters for high PSA got dizzy and weak and couldn't continue the products for a while. What could have happened? Who would like to go for that?
Okay. Okay, can we all hear me?
Yes, we can hear you.
Well, we would need to ask him certain questions. We need to find out if he's taking any other supplements or any other medications alongside the RIDA supplements. And he got dizzy while using RIDA bitters and the fire. At what dose was he using? So there are actually many questions to ask. What dose was he using? Was he taking any other thing? Does he take any other medications? Well, of course, we have the Viagras and co. So was he taking any of that? There may have been an interaction somewhere with something he may be taking, or even normal physiology. His blood level, although it's not so likely with men, but he may be having another medical condition, which just like came up because it has been hiding in there, but because he started taking the supplements, it came out and gave him a little fatigue. So there are several questions to ask in this case.
Thank you very much, Dr. Rita. Yes, I will also add that there may be different reasons why this could happen, and it would be identified from asking those questions, having the answers to those questions, knowing exactly what the individual is on. But sometimes it could just be because there are a few people that start on maybe the highest recommended dose, and maybe all they need to do is pause for a while and start at a lower dose. So it could be that. It could be the dose for him at that point, because sometimes I mean, you can graduate the dose and you tolerate the same dose that that you didn't tolerate when you started on that dose. So yes, a lot of questions to actually, we have to try to establish why that happened, and then that can be addressed. So thank you very much. Now we can see on our screen Emma, would you like to do justice to that?
Go ahead, Ma.
Okay, so I'm so excited about the leaflets, the soft copies for now that are going to follow the solution packs. And this is the female immunity booster pack and the dosage, how the products are used. So we have a lot of answers to questions that were in the minds of many individuals concerning how we use these products, how we combine them together. So this is the female immunity booster pack, and then also there is a note about the hygiene products in the pack, because every pack comes with hygiene products as well. So thank you for sharing that, Emma. Now, let me see whether we have time for it. There's one more question I saw in the chat box. It had to do with a child, a 13, I can't find it, but it's there. A 13-year-old, yes. What's the solution pack for a 13-year-old child born with a brain tumor?
Born with
a brain tumor. Who would like to go for that?
Okay, let me see. For a 13-year-old child born with a brain tumor, I believe that child would already be on some medications. Now, what can we add from our range of products? I believe we should start with the RIDA herbal bitters. We should start with that and a dose of, depending on the weight of the child, we can consider 10 mils morning and night or once a day, depending on the weight of the child. And we may also consider adding cleanser. We can alternate that. It depends on how severe the tumor is and adhesion. What is involved? We may need to see is there an X-ray or a scan of what it looks like, and the progression over time, as in how long has the tumor been there, what has the child been using before then, and what has the progression been. We all know, as it has been said several times, that RIDA bitters has the ability to potentiate even orthodox medications to help them work better. So, adding RIDA bitters to whatever the child may be using would also help resolve the tumor. However, finding out, is it, there are different types of tumors. It can be benign and metastatic as well. So we need to, a lot of investigation has to be done to find out what type of tumor it is, so that we are not playing with fire. If it needs to be surgically removed, it's better to go in and remove it. Thank you very much.
Thank you, Rita. Would any other person like to comment? Dr. Onifade, are you with us? I can see you're with us, but whether we can hear you. Okay, he's here. Would you like to make any comments on that? Okay, bad network. Yeah, basically, I mean, the child with the tumor, there would need to be a lot of assessments. The child needs to be fully assessed. Yeah, I agree with Dr. Rita's comments. Yes, the child would obviously need to be fully assessed. There'll be other forms of management depending on how the tumor presents, depending on what was found, but definitely the bitters would be of use to the child. Cleanser, although we say the capsules, the variants should start when the child is 15, I guess it would also depend on the weight and so many other factors. So that is it. So we are glad we have basically come to the end of today's Wellness Wednesday question and answer session. We're going to have this once a month, and I thank you all for your questions. Even we still have a lot of questions that we had that had been asked, but I felt it was good for us to answer the questions from those who are live in this meeting.
Yeah.
Yes, so thank you all very much. I think there's one more slide. I don't know whether MI is going to be able to share it. There's a document that also goes with each solution pack. If not, I mean, we will see it tomorrow. But if it's there, if we can show it, fine. If not, those pictures, yes. CM is saying sweet picture. The pictures are so exciting. They're beautiful. They're bright. They make you want to even use the solution pack. Yes. So this is one of the documents that's going to go with each solution pack. You know, there's some important notes on it about the fact that the dosages are for standard adults who weigh 70 kg, and adjustments can be made for more or less depending on the weight of the individual, that they are made to last for at least 90 days, and they give an entry into the company. Then it also talks about the fact that, which I mentioned earlier, that the cleanser potentiates the effects of the bitters, and so it's good to be used alongside. And then the duration of use. It's been found that it's good. It's not just a good idea. It's important if you're managing a particular condition to give the product time, and the time here is at least 90 days. Then you'll be able to see and measure the effects. And then we've already talked about this. If you're using orthodox medications, you can still take RIDA, but you space them. So this is exciting, and I want to believe that it's going to be of great value to both the people who buy the solution packs and we that are selling them. So thank you very much, MI. Thank you, Dr. Onifade. Thank you, Dr. Rita. Today is Wellness Wednesday. Next week, we're going to have an explosive session as well. And let's start asking our guests to save the date.